So dancers and gymnasts, they push their bodies to the extreme, not just in the way that they train, but also anatomically. A lot of times the position a gymnast has to put their body in, other athletes would look at it and be like, I'm never gonna do that with my body. And the reality is gymnasts, they have to. That's sport specific, and that's the way that they have to move, and it has to feel comfortable because they have to be able to do it not just once, but repetitively. So when a gymnast arrives, we go through just a little bit of an interview process to learn more about them because each athlete is unique. We need to know what level they're at. After that, we go to the filming portion, and each of the movements that they do is very sport specific and appropriate for what type of athlete they are. Following that, we're gonna want to then examine the athlete, make sure that their strength, their flexibility, and their range of motion is symmetric. We're looking for anything that would potentially help us explain why an athlete is moving a certain way. And then we'll move on to actually reviewing the film. We will use stop animation technology. So in the middle of a back handspring, we can stop when the patient's in the air and show them what their back looks like. And maybe that would help us explain why they're having back pain or potentially why they can't advance to that next level. And then following that, we do at least 30 minutes of a retraining session. So it's not just telling the athlete, here, this is what you need to improve, but let's give them the tools and let's show them what they have to do to become a better athlete, which is really important to them, but also to help prevent injury, which is important to all of us. They'll have pictures of what they look like moving, but you can't just tell an athlete, okay, the next time you go do that, just keep your head tucked in or, sit more back in your hips. That's such a quick automatic process. Your brain's almost kind of on autopilot when you're doing that. So we will take that movement pattern that they need to improve, break it down into exercises that are more simple for them to complete, and they can do maybe a higher volume of it and really be able to pay attention to their form or what we're asking them to do. And then we'll keep sequencing that together until we build it back up to where they can do the skill with better mechanics that hopefully is leading to that injury prevention. Teams are definitely allowed to come in. We can actually do that in a variety of ways. We have the ability to actually travel to the gym, and we've done that before where we'll bring a mobile unit and the cameras, and sometimes that's nice because our athletes relax, they're in a natural environment and they're able to kind of feel more comfortable. Everything that we do here is based on research. It's not just our personal opinions on it or that looks good or I remember when I was an athlete. So everything that we do here has that evidence-based practice. Injury prevention is obviously key because if you prevent injuries, you can stay in the game longer and have better performance. But for all of our sport-specific movement assessments that we do, so if it's a gymnast and they're doing a round-off back handspring, we'll actually go ahead and score that the way a judge would score. So the girls are able to see their deductions, and it gives them a score for that. So potentially then when we reassess and they do it again, we score it again, and they show that they improved. That's really important to a gymnast. Their world is they know their deductions, they know where they need to improve. The beauty of the assessment here is that it's very versatile and adaptable, so you can go from all levels. So you can have your level 1 through 4 gymnasts, which are just starting out, come in for an assessment and then repeat that assessment every single year as they move up in levels so that you can be proactive about watching for changes in their form, changes in their strength, changes in their flexibility, especially as an athlete grows.